Record. Hello, it's Patricia Worby here of Alchemy Therapies, and another in my ongoing series of conversations with other practitioners. And today I've got the very wonderful Carole Randell, who's a friend of mine and a colleague, and she describes herself as a mental health practitioner, and she works particularly in the arena of chronic pain, and is now director, I believe, of the Chronic Pain Relief online clinic. And this is a new venture that you've been developing, I know, in the last few months. So very exciting, Carole, and so needed, isn't it? Let's be fair. Chronic pain is one of those arenas where modern medicine seems to fail most people. Do you have a sort of view about what goes wrong with the experience for most people?
Yeah, and also a bit of a personal view as well, because I've sort of been on a journey myself of recovering from chronic pain. And the sort of medical model that I and many other people are sort of presented with is that you go to your GP and you explain your symptoms, and you'll probably be given a prescription, and then off you go, and that one doesn't kind of work, so you go back again and get another prescription or an increase in dosage, or you might get a referral to a consultant. So it's, you know, it's a well-trodden path by so many of us, I guess. And one nowadays, which I think is not very satisfying, because, you know, we really want to know an outcome. We want to know what can we do about this ourselves. We're not, you know, sort of like parents and grandparents where what your GP said was you went and did it. You know, we've got resources now. We've got Mr. Google, for example, and books to read, and other people to talk to as well.
Some would say there's an overload of information, actually, and what you choose to pay attention to is really important, isn't it? And there's a lot of fear around diagnosis and that sort of thing. So you end up going from GP to specialist and all around the houses. That's certainly my experience. Was it yours? Did that happen for you?
Absolutely, not just one, you know, because I went with so many varying symptoms, all associated with pain, but nobody could find an underlying cause for it. I'm, you know, be very open about this. You know, I was finally diagnosed after about 6 years in total with fibromyalgia and chronic fatigue. And, you know, even when I got that diagnosis, that was literally it. I was sort of given a leaflet and said, well, that's it. You know, you're going to have to just cope with it as best you can. There's nothing we can do. Here's some more tablets. So I was on tablets for sleeping, pain, antidepressants, you know, you name it. I was kind of given it, and but they just didn't work. So in the end, I just gave them up, because I thought, well, it's not working taking them. I might as well just give them up and see what happens.
Yeah, and that, I presume, led you to explore alternatives, because you would want to maybe solve the problem and find out if anybody else had any better idea of what was going on. How did you come to where you are now? What's the sort of pathway that you found that worked for you?
Yeah, okay. Well, I went down this road of trying all sorts of things, holistic as well as conventional medicine, and nothing seemed to quite hit the mark. And there's all sort of like that missing piece to the jigsaw. And then I found the chrysalis effect, and that's where we've met each other, isn't it, as colleagues, and went into their recovery program from chronic fatigue and fibromyalgia. And they looked at 8 areas of your life. It's a very holistic approach. I went through 6 of the 8 areas and then came up against the emotional component of recovery. Each time I came up to the emotional component of recovery, I backed off, thinking, I've done all of this because I'd been in counselling for some time. I'm sure I can cope with this. And off I went on my jolly way. And each time I then had another crash, until eventually I realised that actually there's some deep stuff going on here, from adverse childhood experiences, dysfunctional family element as well. And not just me, but it sort of went back generations too. So definitely there is a strong body-mind link.
Yeah, So really what you're kind of saying is that there's far more to it than this current model allows. You know, the current model says it's based, as we know, on a sort of infectious disease idea that you've got one causative factor and one solution, and it doesn't allow for individuality. But it basically also says that the body is a sort of passive recipient or victim of whatever it is that ails it, rather than an intelligent, sophisticated communication network. And I guess the emotions are so important because they are part of that communication network, aren't they? That signals health or well-being to the body. You know, I know with my journey, it was the last piece of my puzzle, you know, and it was the bit I resisted as well. Like, you know, there's nothing wrong with me emotionally. I'm fine. I'm absolutely fine. You know, I don't have any emotional issues. That was definitely where I was coming from. Not realizing that a lot of them are covert. They're under the radar. They're from times in your life when perhaps you were vulnerable, a lot younger. You weren't aware necessarily of some of these things happening, but your body remembers. It remembers the times you were unsupported or overwhelmed, you know. So for me, and it sounds like for you, that was a big aha moment, wasn't it? And so what did you do? How did you get to where you are?
Well, I went back into counselling and did a lot of emotional work on inner child, because although I knew emotions were an issue, what I hadn't believed or understood was actually I wasn't feeling anything. It was almost like I'd been chopped off from here. But I'd got all this pain stuff going on down below, but had no idea that it was connected to emotions. So I went into counselling for about 2.5 years, quite deep stuff. And then when I came out of it, I got much more interested in how the body and the mind work, and trained then to be a psychotherapist, and worked with recoverers, with people from drugs and alcohol, because that was in my family background as well. So it just fascinated me, the whole you know, thing, and the pathway that people take. And then I became involved with the chrysalis effect as well. Took a lot of their additional training. And the more training I took, the more I realised how much our body and mind are connected. And then I heard about Dr. Sarno, became very interested in his work, and Bessel van der Kolk, Peter Levine, all that, David Hanscom, all those sorts of people that talk about how important it is to be able to re-engage with the body and the feelings, which then equate to the emotions. And by learning about that, that's how we start to really heal.
Yeah, it's very interesting, isn't it, that modern medicine misses out that entire arena. People can go with a set of symptoms, and the symptoms are looked at individually, but nobody pieces it together as what's happened to you. What was it in your life that has predated these symptoms? You know, what's going on? When I'm working with people, it's often really clear that they've had quite severe lack in their childhood experience. I mean, not necessarily full-blown abuse or overt trauma, like the sort, if you know, if you grew up with alcoholic parents, but things that didn't happen that should have happened. You know, support, connection, reassurance, a sense of internal safety, and that seems missing. And isn't it funny how the body interprets that as pain, you know, physical pain, I mean. I know that's the work of Sarno. I mean, he did sort of, he was one of the first people that I ever read that made that connection, that the brain kind of interprets emotional pain as a sort of downregulation of suppression of physical pain. And so you get this chronic, persistent pain in, well, all parts of your body. I mean, that's what fibromyalgia is, isn't it, generally? So So we have to move away from this idea that we are just physical. If we've got a physical problem, we only treat it physically. We've got to get into what are the predispositions, what are the personality sort of predispositions, as well as anything else. I know for me, it was sort of exactly, you know, I was a bit like you. I didn't sort of look below.
Yeah.
I was very much focused on what I could achieve and how hard I could work and what success I could have, and that kind of pushed away any negative feelings I might be having that I'm not looking at because I don't want to look at it. So it's understanding, isn't it, that we're multi-dimensional beings, that we have energetic components as well as physical ones.
Absolutely.
And emotions are energy, aren't they? They're energy in motion. That's the way I think of them. So what do you think are the most profound emotional drivers of pain?
I think it is a message that we're not hearing. I think that's the biggest thing, is that just to be aware that we have what they call triggers, that with the events in our lives that we may not have been able to deal with at that time for whatever reason. We may not have been emotionally mature enough, or the situation was, you know, a dangerous situation, so we haven't worked its way through. So I think, you know, what the body does is very kindly, in its own way, sends us these messages and triggers to say, actually, you need to stop long enough to listen and think about what's happened and what's going on and what I'm trying to say to you, really.
So pain is a message from a deeper, maybe subconscious part of you that is in pain, whether emotionally or in some other way. And we need to heed that message without fear, don't we? Rather than, I think what modern medicine does is it sort of encourages us to fear the responses of our body, and the symptom becomes the problem. You know, so if I've got, I don't know, heart palpitations or dizzy spells or whatever, I'm saying to myself, oh my God, I'm going to have a heart attack and die, rather than what is my body trying to tell me in this moment? What is it that's before this moment unconsciously triggered me? I think you've introduced that really brilliantly. Because triggers are everywhere, aren't they? They're in the time of year. My goodness, how many people I've had this week say to me, as soon as the clocks change,
Yes.
I start to feel really anxious or miserable or shut down. Some people honestly get dizzy spells because their mind will go back to other times when perhaps this time of year was frightening. If they had to go back to school, for instance, or spend time in places that were unsafe for them. Childhood is a very, very vulnerable time, isn't it? And
absolutely,
right through probably until, you know, early 20s, I'd say, we're all very vulnerable because we're still developing. Our brains are still developing, aren't they? So what do you think, what's the most important thing that you did in order to kind of, obviously you looked at this multi-dimensional view, holistic model, and you trained as a psychotherapist, but on a personal level, was it forgiveness? Was it coming into alignment? What did you do?
I think for me it was understanding that it was okay to be vulnerable, and actually it was safe. There was safety in being vulnerable, because that was obviously my biggest fear, that if I was vulnerable, I put myself in a position where perhaps, you know, I wasn't going to get the best outcome, and that's something I'd learned from a very early age.
So if the message is you can't be vulnerable because it's not supported, you're going to learn to suppress that belief about vulnerability being okay. And so you're going to present to the world a very capable face, a mask of strength, which is kind of, that does definitely chime with me. And as I say, I was a person who, you know, didn't believe there was anything wrong with me. And so I guess a lot of people make that mistake of thinking what's in the past is over and won't be affecting them now. And they're very surprised when I say, you know, some of the early imprints of childhood, even if they weren't overtly abusive, maybe just not being heard, as you say, not being allowed to be vulnerable, which is a big part of learning that we're okay in ourselves, that we can lean into a difficult situation expecting it to be all right, expecting to have someone who's got our back. And when that isn't present, which it wasn't for me either, you learn that you just can't go there, which sets us up, doesn't it, for long-term chronic illness.
Yeah, I mean, just a classic example, particularly, you know, tension around here and frozen shoulders and things like that. That is about making sure your back's covered, you know, so you're on total alert all the time, clenched up muscles, because you're worried about somebody might, you know, you might not see what's coming. Yeah,
that's a typical fight and flight response, isn't it? Shoulders and arms, sometimes also legs and hips, involved in either fighting, protecting you, or wanting to flee, you know, run away, get out of that situation. And it's like the energy of that escape response is stuck because it didn't get to complete. We didn't get to run away or fight because the situations were not, we weren't able to fight our parents, or we weren't able to run away. So frozen shoulders are a very common example, actually, that I see in a lot of, usually it's middle age when that hits.
Yes.
Any theories as to why it should be that time of life when we get these issues?
I think probably because you've been shouldering a burden for quite some time by then, you know, and it's just piled one on top of another, on top of another, on top of another. But also it's possibly the first time that you've got some time to yourself. Your children might be growing up, going to university, you know, you've been in a career, and you're just sort of starting to slow down a little bit. And then suddenly these things kick in, because you've allowed yourself that little bit of space to actually feel what's going on here.
The distractions have gone, I guess. And that's very interesting with what's happening now, because a lot of people have had their lives turned upside down by COVID, and we are finding an increase in anxiety, depression, isolation, where people would often bury themselves in work, which would be away from home. Now they're having to, if they're able to, work from home, and lots of tensions arising there, and lots of time to kind of think, oh, who am I, what do I want from my life, you know, and finding actually that there's a lot of uncomfortable feelings around that we can no longer distract ourselves from. But there's also, I think, a rise in childhood, you know, a teenage, particularly anxiety, and so it's not just middle age that's a difficult time, is it? It's around puberty and that transition from childhood through to adulthood. I don't know with your clients, you know, who you see a lot of, but I do see more and more young people coming in with anxiety, chronic fatigue, those sorts of things, which were pretty much unknown when I was their age. You know, I didn't know anybody with chronic fatigue syndrome.
No,
I'd not heard of it.
The majority between about 23 and 25 are the ones with I see with chronic fatigue. Not so much more the older people. By then it's gone into the medically unexplained symptoms, and you know, the chronic pain gone deeper. But usually when they've sort of got that university decision or coming out of university, you know, and actually it's not who they are, but they don't know who they are, because it's that expectation thing, isn't it, from parents, grandparents, or this is what we've always done, or you know, dad's a doctor, or mum's a lawyer, or vice versa, you know, it's that type of thing. So
there's definitely a stress around expectation of living a life for someone else, and not really looking at your authentic self. You know, what is it you want to do? A lot of the young people that I work with have been told by a parent, you know, we want you doing a professional job. We don't want you to be a dancer or a painter or a vet, even if they love animals. You know, we want you doing something that's much more sort of money orientated. And so the model is that you have to conform and fit to someone else, isn't it? and that's very signaling to the body of dysfunction. It actually signals a lack of repair. I was talking about that this morning, and that emotions like humiliation, betrayal, shame downregulate the whole system, and so you end up having difficulty sleeping, then you can't functionally repair your tissues, and then certain things start to happen to your body, like you start to not be able to sleep, you can't digest properly, you're getting all sorts of issues. So you've come to this realization, and you've decided very recently that you're going to form an online clinic, but it's not on your own, is it? You've definitely decided to create a new model, a more collaborative model. Tell me a little bit about that.
Okay, so I've always had this vision that I wanted a clinic online, because I wanted it to be available to people where they're at the most comfortable. So that may be, you know, at home, it may be at work even, or even in their car, you know, it's just somewhere that's easily accessible to people. I absolutely know that, particularly with men, I've seen a huge increase in male clients, because actually they feel much more comfortable about doing it online than they do going to make an appointment and being visible sitting in a waiting room where perhaps they might be recognized, and we've still got this what do you call it, label around men that anything with mental health and emotions is, you know, doesn't make you male. You know, as daft as it is, it still goes on even in this day and age, you know. So that was some of the thinking behind why I decided to go online, but also because I could reach out further to people. So not just in my immediate vicinity, you could reach out, you know, to the wider population, to people that may not necessarily have the access to mental health services.
Yeah, very important. Yeah, and I mean, I totally agree with you. I think there is a stigma around seeking emotional healing of any sort, or psychotherapy even, which may affect men more than women, perhaps because they're sometimes less inclined to share emotions. And it's not true of all men, but it's definitely culturally that's definitely a factor. And you've brought in some people to work with you. You've got a variety of different tools. I think that's what's so important, is that you're not saying you know everything and you can sort everybody, although I know you do brilliant work. We have to kind of be a bit humble, don't we, in this new model, this biopsychosocial model of health and healing, is that we need different inputs to get the right information out, you know, the right sort of healing information. So you know, how do you kind of conceive of this new collaborative model? What's your hopes for it?
Well, so far we've been very successful. I mean, generally speaking, I will refer to another practitioner that I think may be more beneficial to the client, even if it's just for a few sessions. I'm particularly keen on nutrition, and making sure that nutrition forms the basis of some of the work that I do as well, because I think that's really important. And that's about self-care initially, and about nourishment, and making sure that, you know, that you're really looking after yourself, and you appreciate that what you put in comes out as well. So that's part of this whole holistic view. I've also got other practitioners, one that works with adverse childhood experience, trauma, abuse particularly. That is quite a specialist area, and although I can work with people like that, sometimes they just need somebody to work with who's had that experience themselves, and they feel much more comfortable talking about it. So the practitioner that I have, Beverly Webb, she has gone through the care system and has been you know, part of that sort of abuse in childhood as well. And then I've got Amanda Collins, who works in a very different way. She works more with what was the word that you used earlier? to
Well, the sort
me,
of
Patricia.
biophysics, the
Physics,
electrical
yeah,
nature, yeah.
yeah, that's
Mm.
it, yeah. And she does things like scar release tissue and
Mhm,
things like that for
mhm, mhm,
people,
mm,
but also looks at balancing the body,
mm,
does a lot of EFT and things
mhm,
like that too. And again, it's something I can do, but
mm,
actually it's better to refer even just for a couple of sessions for
mm,
something more specialist. And then we've got Elaine Darcy, who's our nutritionist.
fantastic.
Yeah.
So it's a really, it's how the health service, I think, is designed to work, but it doesn't work so well for chronic conditions because you tend to get siloed, don't you, into
Yeah.
one specific, what they call specialty in
Mm.
the healthcare model. Whereas with holistic practitioners, we tend to appreciate that we can move between different
Mm.
areas at different times, depending on the needs of that individual client.
Absolutely.
So it's much more flexible, I think. It's
Yeah.
certainly what I've noticed is that some people I may refer on and then they do a few sessions with someone else and then they may come back to work a little
Back.
bit
Yeah.
more with me and so on. And
Mm.
so I don't want to get sexist about this, but I think it's time to kind of put in that the collaborative model is a much more, I want to be careful about this, but it's a feminine energy, if you like. And I don't even mean
Mm.
that it's anything to do with feminism or anything like that. I mean, it's like collaboration is based on Mother Nature. All right, that's
Mm.
what Mother Nature does. You know, organisms collaborate. Our microbiome collaborates with us. You know, it helps to actually change our DNA so we can adapt better. But what we've been taught is the masculine model of competition, and that we're all competing
Mm.
for clients and we're all at risk of not having enough, you know, that scarcity thing as well.
Mm.
And what I
Mm.
love about your vision is that you are pulling in this whole idea that we can be more if we collaborate. We can actually
Mm.
enhance each other and support each other. And there's a lot more teamwork actually. And from the client's point of view, they get a better result.
Yeah, absolutely. And I think,
So,
yeah, because I'm, as a practitioner, in a much better place having colleagues around me that I can actually say to them,
mm,
you know, because obviously with our team meetings, you know, we do case studies and
mm,
things like that.
mm,
They are obviously anonymized, but it does help to be able to say, well, look, this is what I've found. This is what I think. Have you got any other thoughts on that as well? So
mm,
it brings a much broader, deeper
yeah.
result to the client and what we can actually offer and give to them in the way of support.
Mm, mm. I love it. And it just ties in for me with the idea that we need to take more responsibility for our health, and that clients come in and they're nurtured and they're supported, which they may never have had.
Mm.
I was talking with a friend today who's been through the current sort of cancer care system, and it's
Mm.
very much about fear, and you know, you've got to get it quickly because it's going to destroy you, and of course then you just react with the first thing that you're given,
Yes.
and you follow orders, so you become very,
Yeah.
very compliant. And we're seeing
Mm.
this a lot around COVID as well. You know, when people are overwhelmed with their information, they tend to go for the first thing. You know,
Mm.
you'll just become quite compliant. And I really try and emphasize to people that your body is a healing system. You know, it might get blocked, the healing might get blocked for various reasons, but there are mechanisms to enhance the body's own innate intelligence to bring you back to wholeness. And that for me is the holistic model in essence. And it
Mm.
doesn't deny science, because science is so key to understanding the
Mm.
body and how it works. And I know, you know a lot about the brain and how it works, so it's fantastic. But we need to kind of see it from a more coherent, cohesive, whole, informed model, don't we? And I think
Mm.
that's what you're doing. And I just want to, again, because I've already said how wonderful I think that is, but
Thank you.
you know, I do think it's such a major step forward for practitioners like you and me to start saying we need our message out there in the
Mm.
mainstream. We
Mm.
don't just want to be classed as alternative and out in the back streets, you know, where you have to
No.
find us. That we want to form clinics, we want to form this this collaborative idea that we're out there, we're available, and we don't have all the answers, but we certainly have a more profound, I think, answer than the current symptom-based medical model, which just suppresses each symptom as it arises and has
absolutely.
no linkage. So it's just wonderful what you're doing, and it's wonderful as always to talk with you. And I know we could go on for hours more, no doubt, on all aspects.
And we do sometimes.
We do, don't we?
Yeah.
But I'm going to draw it to a close. But if people want to get hold of you, Carole, how do they do that?
Yeah, so I've got a website, chronicpainreliefonline.clinic. You'll find all the information on there, or just put my name into Google, and there's apparently pages of stuff that come up. So it's a bit scary, really. Yes, thank you.
That's the nature of the electronic world we're in, isn't it?
It certainly is,
yeah, fantastic, Carole. Well done, and looking forward to seeing it grow from strength to strength. So brilliant. All right, folks. Check in, tune in, subscribe, do all the right things. I'll put all the links below. Thanks for listening. Bye for now.
Bye.